Good afternoon, everyone. My name is Laura Guzman-Corrales. I use she, her pronouns, and I'm the Public Health System Transformation Coordinator in the Community Health Division. I'm excited you're listening to this webinar today to learn more about how we are strengthening Minnesota's governmental public health system. This is a first in a series of events to share big ideas and lessons learned around how to create a public health system that can meet the needs of every Minnesotan today while being prepared for the changes of the future. While there are many components to this work, this webinar will focus on some of the background reasons why we are undertaking work to strengthen Minnesota's public health system. We'll spend some time learning about the Foundational Public Health Responsibilities Framework and discuss why this is important for MDH staff to know. First, I would like to share some background for this work. The system transformation work we're talking about pertains to the governmental public health system. In Minnesota, the governmental public health system is comprised of state, local, and tribal governments. At the local level, there are 51 CHPs and 72 local health departments that are responsible for many public health activities in their jurisdictions. Then there are 11 sovereign tribal nations that share the same geography with Minnesota, with their own public health authority. And finally, the state health department and its district offices operate statewide and in partnership with tribes and CHBs, providing services as well. Each level of government has its own authorities that are outlined in state statute. The Local Public Health Act was passed in 1976, and it serves as the legal framework for Minnesota's current decentralized public health system. Tribal governments also have public health authority that is defined through a combination of federal treaties and laws and state statute. While Minnesota has one of the best performing public health systems in the country, there have been many social, economic, and technological changes over the last several decades that are straining the current public health system. You can probably think of many. They may have even impacted your own work. Things like funding cuts, workforce changes and challenges, persistent inequities and poor health outcomes for some populations, and emerging issues like the opioid epidemic and the COVID-19 pandemic, among many others. Statewide assessments and other data have highlighted these ongoing challenges for many years. It culminated in a 2017 assessment of all 74 local health departments and an assessment of MDH and local health departments in 2022. Both of these assessments had similar findings. They found wide variation in capacity and performance among health departments across the state, increasing pressure on MDH and local health departments to provide more services without additional resources, activities that are driven by funding or grant priorities instead of community priorities, unsuccessful attempts and some successful ones to get legislative funding for public health infrastructure, and persistent workforce challenges, especially in more rural parts of the state. The challenges our current public health system is facing are complex and require strategic and systemic change. If we change just one factor, it can impact others, as it would in this mobile you see on the screen, where moving one component moves the rest of the mobile. We can't just zero in on a technical assistance or quality improvement fix for one part of the system. We really need to be looking at the system as a whole and the complex challenges it's facing as we consider what types of strategic changes are needed. With all of this context in mind, MDH is supporting new efforts to strengthen the public health system. The first and most important is to participate in establishing a joint leadership team to co-create a vision and roadmap for a stronger public health system. This group is comprised of representatives from the Minnesota Department of Health, the Local Public Health Association, and the State Community Health Services Advisory Committee, also known as SHAC, which advises the commissioner. They put forth the vision for their work last year, and that is a seamless, responsive, publicly supported public health system that works closely with the community to ensure healthy, safe, and vibrant communities. This system of state, local, and tribal health departments will help Minnesotans be healthy regardless of where they live. Some examples of projects happening under the direction of the JLT include a policy and system assessment to understand the gaps and needs of the current system. In parallel, 2 Native led organizations are also leading a tribal capacity assessment process to understand the assets, gaps, and possible collaboration opportunities for tribal nations in Minnesota. We've also undertaken a message, research, and framework development process to speak in a clear, unified voice that builds public support for public health. We're also working with partners at MDH and local public health on data modernization efforts that are aligned with our agency data vision and roadmap. Finally, we have new state funds to pilot innovative service delivery models and increased funding to support the foundational public health responsibilities for both local public health and tribes. These are just a few of the strategic activities being led by the Joint Leadership Team to strengthen our public health system. But we know there's a lot of other work happening across MDH, local public health, and tribal nations that is aligned with the vision of a seamless, responsive, and publicly supported public health system. All of these efforts are critical to ensuring the system is ready to meet the needs of the future. Today, we're going to spend our time talking just about the foundational public health responsibilities, which is core to several other activities. We'll explore other projects in future webinars, brown bags, and communications. So the Foundational Public Health Responsibilities Framework is a national framework that represents the minimum level of service that should be available in every community and what every Minnesotan should be able to expect from their public health system. Some of you might remember that Minnesota developed a Minnesota-specific framework, but after updates were made to the national framework, the JLT chose to adopt that model instead. So we use the national framework, which was developed by the Public Health Accreditation Board, or FAB. As you can see in the framework, it's divided into two main groups. The first is the foundational areas, which are basic public health topic-specific programs and services aimed at improving the health of a community. Then we have the foundational capabilities, or cross-cutting skills and capacities needed to support basic public health protections, programs, and activities. All of the activities that are represented in this framework under these headings happen at the population level, not necessarily the individual level. And while direct services provided by public health are certainly important, they are not necessarily considered foundational. And these are all complemented by community-specific services that are local protections and services that are unique to the needs of a community. These are essential to that community's health and vary by jurisdiction, and they speak to the need for local flexibility to determine some of their own priorities in addition to these foundational areas and capabilities. Before we dive into what these components mean, we want to note a few areas that are really needing additional discussion and where we hope to provide more information in the future. The first is that the framework does not necessarily address roles and responsibilities or who does what in the public health system. This means it doesn't determine if state, local, tribal, or other entities are responsible for completing a specific role or responsibility, nor does it address how much or how well these actions need to be performed to be enough. There are formal work groups through SHAC and informal guided conversations happening right now to work through these two important aspects of the framework, including better definitions of each activity and ways to measure them. Before going any further, I want to pause and talk about why we think this is important and worth sharing across MDH. The first reason is that it really sets the minimum expectations for what everybody should expect from their governmental public health system, regardless of where they live. And I want to note that a lot of these activities are happening across the state, and it's work that in local public health tribes and MDH are carrying out across most communities. But as I noted in the beginning, we do see some gaps. And so that's why the increased funding and emphasis on foundational public health responsibilities is so important. It also aligns with MDH's strategic plan and equity goals to ensure that we're building a system for the future. The Foundational Public Health Responsibilities Framework helps identify gaps and resource priorities and evaluates progress toward fulfilling foundational responsibilities. It also helps provide an opportunity to increase role clarity and coordination across state, local, and tribal public health. And perhaps most importantly, it ensures that every person and community across Minnesota can reach their optimal health and well-being today while ensuring that our public health system is prepared for the challenges of tomorrow. So now we're going to dig into some of the details of the framework. This can be an overwhelming amount of information, especially if it's your first time learning about or seeing the framework. So we're just going to talk about 1 to 2 example activities for each of these categories at a time. If you're interested in a more detailed breakdown of foundational public health responsibilities and activities, you can visit our website, which is linked at the end of this webinar. Areas are how we group the topic-specific public health programs and services. These will probably feel more familiar to many of us who have been in public health for a long time. You could probably think of programs and divisions across MDH or local public health that are responsible for these activities. They might even be called this on the org chart. So these are a little bit easier to understand and see in our day-to-day public health system. For communicable disease control, one example activity is to provide timely, accurate, relevant information related to communicable disease control. For environmental public health, an example activity is to protect workers and the public from chemical and radiation hazards. For maternal, child, and family health, an example is to assure newborn screening, including wraparound services, follow-up, and service engagement. For chronic disease and injury prevention, an example is to reduce statewide and community rates of commercial tobacco use. And for access to and linkages to care, example activities are to inspect and license healthcare facilities and to license, monitor, and discipline healthcare providers. Now let's talk about the capabilities. There are 8 capabilities that are considered cross-cutting skills that make it possible to support and perform essential public health activities like the ones we discussed in the previous slide. For example, strong community partnerships can make it easier to provide relevant and timely information on an infectious disease outbreak, or tailored communications can support newborn screening and follow-up information getting to the right community. They also ensure community health and well-being is achieved equitably. You may have also noticed that these are aligned with FAB accreditation standards and measures for those of you who are involved in the accreditation process. I'm going to go through these again one by one and provide a couple examples of the activities that fit into each of these buckets, as we like to call them. As we go, consider what parts of your work are foundational and fit into this framework, or maybe where you see some gaps in capacity. First, we have assessment and surveillance. This includes conducting a statewide or community health assessment, a process that MDH just completed. It also includes working with partners in the community to collect, report, and use public health data. If you look at the framework in detail, data will appear in a number of places. But note that it's really not just the responsibility to collect and analyze the data, but we should really be ensuring the data is used to inform work across the system. Next is community partnership development, and that includes developing and sustaining relationships with partners in the community and establishing and maintaining trust in an authentic way. I find this to be a particularly important activity because it speaks to the responsibility of state and local governments to establish relationships with community partners as a foundational activity. It's not just something that's nice to do if we have the time or we have staff that have the skills or the knowledge of how to engage with community. But in order to really be meeting our minimum expectations for the system, it's something that state, local, and tribal partners should all be doing. Next, in the framework is equity. And you'll see equity encircles the whole framework as well as a standalone capability. This is because equity should be both a process that is embedded in everything we do, as well as an outcome of our work. A couple example equity activities include strategically addressing social determinants of health and working collaboratively to ensure a shared understanding of and language around equity. Next, we have organizational competencies. And these are the operational components of the work that keep the wheels of the public health bus moving. For example, finance, contracts, and operations includes activities like maintaining a financial system, having the ability to secure additional funding, taking care of facilities, and making sure there are resources related to equity. Next, we have policy development and support. This includes being the subject matter expert for health-related policies, including researching, analyzing, costing out, and articulating the health impacts of policies. It also includes activities around supporting compliance and regulation of policies, codes, and statutes. Next, we have accountability and performance management. This includes maintaining a performance management system and using evidence-based or promising practices to implement programs. Our next capability is emergency preparedness and response. And while we might think of that as an area, it shows up in the foundational capabilities section because it's really a cross-cutting skill that supports and enables our other public health activities. It includes developing preparedness response strategies and plans. It also includes issuing and enforcing emergency health orders in the event of an emergency and being ready at any time to learn about and respond to emergencies. And finally, we have communications, one of the things that is in just about everything we do. Two example activities are to tailor communications to the specific audience, and another is to effectively use social media to communicate directly with the community. Again, this may be a capability that we see showing up more easily in our work and is easier to grasp and is also very important. In wrapping up the discussion of the framework, I just wanted to highlight a few key points. First, community-specific services are a key part of the framework, and these will vary by jurisdiction. Next, just because something isn't foundational doesn't mean it isn't important or worth prioritizing. You may not see your specific program or activities fully represented, or there may be some components that are foundational, like building community partnerships, and some that are not, like delivering a specific intervention or program to a specific population. We're still learning, and that's okay. The next thing is that we're still learning how to define and incorporate the foundational public health responsibilities into our work at the state and local level. And this is a really dynamic and evolving area. In some ways, this work has always been happening. These are some of the foundational activities public health has always done, but we're really trying to understand what's needed to fully invest in the system to ensure that everyone across Minnesota has the same level of services. So we're really learning a lot using this new framework. If this is interesting to you, I would highly encourage you to share the framework with your team and explore and have some conversation about it. I've provided some questions for your team to explore, including things like, how could the foundational public health responsibilities framework help us to understand the strengths and gaps of our current public health system? How else can the framework guide MDH programs and staff to make our statewide public health system more seamless across jurisdictions, more responsive to existing and emerging needs, and better supported by the public? What are you doing in your program areas to strengthen relationships with local and tribal public health partners? And what resources and supports would help you in strengthening these partnerships? If you want to learn more, I highly encourage you to sign up for the new JLT newsletter to receive high-level updates about how we're strengthening our public health system. Also, I encourage you to check out the website, especially if you want to dive deeper into the FPHR framework. You can also learn more about a new grant opportunity or several new grant opportunities to support foundational public health responsibilities for local public health and tribes. I encourage you to stay tuned for additional webinars and lunch and learn opportunities. And finally, send any questions or requests for more individualized conversations to me, Laura Guzman Corrales. I encourage you to have these conversations at the division, section, and unit level. Sometimes it is more beneficial to dig in with your team to understand what this framework means and where you see your work reflected in the framework. We are here to support you in that work, so please don't hesitate to reach out if you want support. Thank you for listening to this webinar today. I encourage you to share this with others across the agency and stay tuned for additional activities.